back to CHD Unpacked, a podcast about living with congenital heart disease. This podcast is brought to you by the Canadian Congenital Heart Alliance. I'm your host, Amanda, and today we'll be unpacking the topic of congenital heart disease and the transition from pediatric to adult care. We're very excited to be joined by today's guest, Dr. Andrew Mackie. Dr. Mackie is a pediatric cardiologist at the Stollery Children's Hospital and a professor of pediatrics at the University of Alberta. He did his cardiology fellowship at Boston Children's Hospital and completed a Master's of Science in Epidemiology at the Harvard School of Public Health. His research is focused on improving the transition process from pediatric to adult care for adolescents and their parents. Dr. Mackie and colleagues from across Canada recently received a team grant from the Heart and Stroke Foundation that is focused on care transitions across the lifespan of individuals with CHD. Please join me in welcoming Dr. Andrew Mackie. Hi, Dr. Mackie. Welcome to CHD Unpacked. Thanks so much for joining us today.
Oh, thanks for having me, Amanda.
So today we're going to be talking about CHD and the transition process from pediatric to adult care. So just to start off, can you tell us a little bit about the scope of your practice?
Certainly. So I'm a pediatric cardiologist, and I practice at the Stollery Children's Hospital in Edmonton. I'm also a professor of pediatrics at the University of Alberta. So I look after newborns up to teenagers at about 17 years of age with congenital heart disease, both in the inpatient setting and in the ambulatory clinic. I completed additional training in echocardiography at Boston Children's Hospital back when I was a trainee, and so I'm part of the echo lab at the Stollery as well. I have a few other roles. I teach pediatric residents and cardiology residents and fellows on a regular basis, and I supervise students and trainees in research.
Great. Thank you so much for sharing that with us. And to just kind of start off the episode, can you explain how the transition process from pediatric to adult care usually works?
Yeah, great question. So let me start with a bit of a historical background. Until about 10 years ago, most programs in Canada and in North America and Europe in general weren't really doing anything to help adolescents and young adults with transition, other than referring patients to an adult congenital heart disease clinic when they got too old for the pediatric clinic, and hoping that they arrived in the adult clinic and things went okay from there. In some cases, pediatric cardiologists held on to adult age patients into adulthood, either because they didn't feel that they had an adult specialist to refer their patients to, or because they felt that they wanted to continue to look after adult patients. And unfortunately, many young adults dropped out of care, up to 50%. And of those who did show up in an adult specialty congenital heart disease clinic, many had very little knowledge about their CHD, which made it difficult for them to manage their condition in partnership with their new providers. Many thought they were cured, for example, and they were unaware of the need for lifelong follow-up. So to be honest with you, the whole situation was a bit of a mess. Now in 2024, things are better, but there's still room for improvement for sure. For example, some programs have started preparing teens for transition a few years before they need to graduate from the Children's Hospital. And so they teach them about their hearts. They may help summarize their heart health information into a sort of portable health passport that the teen can keep on their phone, for example. And there may be some coaching about some of the skills that they will need on the adult side. And they are also emphasizing now that even though their heart is maybe good, it's not cured, and that there therefore is a need for lifelong care. And my team, including my colleagues in nursing, and colleagues of mine at Sick Kids and BC Children's Hospital in St. Justine, we've done research together to show the benefits of nurse-led transition preparation. And it really does help teens a lot with respect to knowledge about their congenital heart disease and having some skills that they're going to need on the adult side. Some clinic side have also, started making good formal arrangements with their adult congenital heart disease specialist colleagues in terms of making sure that the transfer of medical record information from the pediatric program to the adult program goes smoothly, so that the adult providers have all the information they need to take over the care of this young adult. But to be honest with you, we don't really have good Canadian or North American data to tell us right now how many programs are actually doing everything that I just described. We do have pretty recent data from Europe showing that still about 60% of programs in Europe are not really doing much with respect to transition. So what I've been describing in the past few minutes is the ideal situation, but it's certainly not happening everywhere that it ideally ought to.
And can you touch on why it's so important to have a smooth transition and why it's something that centers across the world should strive for?
Absolutely. So, congenital heart disease is a lifelong condition, and that's why the success of a transition program is so important. Congenital heart disease doesn't go away the day somebody turns 18. If only life were so simple, right?
Yeah.
So as a pediatric cardiologist, I obviously want the very best for my patients throughout their adult lives once they graduate from the Children's Hospital. And so to me, that means not only do I want them to arrive in the adult clinic, but I want them to feel like they're welcome there and they belong there. And I want them to have the ability to do some simple health-related tasks like renew a prescription or make an appointment or ask appropriate questions of their cardiologist or be able to answer questions that their cardiologist asks of them. I want them to be able to know when to seek emergency room care. All of these tasks are really important. And as you know, we invest so much in the pediatric world in terms of trying to provide the very best congenital heart disease care that we can. And it would seem so unfortunate and ironic to not set up our teenagers and young adults for success as they enter the adult healthcare system.
I appreciate you highlighting that. And I think the concept that you touched on previously about the conception of being cured is something that's very prevalent in the CHD community, and I think something that we're trying to work away from, because someone could think that they might not need as much care now that they're older and they've kind of had years between maybe their initial surgery or their initial diagnosis.
Absolutely. And so, in the transition preparation that we do in our program, we talk a little bit about some of the potential complications that can occur down the road. And that's part of the whole messaging that, they're not cured. But obviously, we want people to have hope and to feel optimistic and to feel good about their health. We inadvertently send a message that they are not at risk of complications later in life, then we're doing them a disservice.
Right. Yeah. I appreciate you highlighting that. I think that it's important to recognize the condition one has while also encouraging them to, have autonomy within their own health and live the lifestyle that they strive for, while also being mindful of any complications that could occur in the future.
Absolutely. Worded well.
Thank you. So could you touch on the term loss to follow-up? I know that's something that's kind of used within this discussion of transition. Can you explain what that means and how often that might occur within the CHD community?
Sure. So when we talk about loss to follow-up, what we are simply saying is that some patients don't come back for outpatient care within a time window that we would hope for, or that we would have recommended at the time of the previous appointment. As a pediatric cardiologist, when I see school-age kids or younger adolescents, I make it clear, I think, to them and their parents when I'd like to see them next. And likewise, when patients leave the pediatric program, we make a recommendation to them and to the receiving adult specialist as to when ideally their first appointment would be in the adult clinic. And so studies about loss to follow-up have used different definitions. Some say that a window of time of greater than 2 years between two outpatient appointments would be considered loss to follow-up. Other studies have used a definition of 3 years, and still other studies have said that if an appointment is more than 6 months after it was supposed to be, then that would be a form of loss to follow-up. And right now this happens in about 25% of persons with congenital heart disease, having a loss to follow-up, or sometimes lapse in care is another term to mean the same thing. So 25% is an awful lot, and that's here in Canada. It used to be higher 20 years ago. It used to be about 50%. And so we're doing better than we used to, but we can do better. And in Europe, for example, it's only about 7%. So we have some work to do here in Canada.
Yeah, seems
a shout out to the McMaster team. They did report a study a few years ago that only had 4% loss to follow-up, which is a very impressive accomplishment. But that is really the exception rather than the rule. 25% is overall where we're at in Canada right now.
And can you speak to some of the challenges that someone might face in the transition process that could be contributing to this 25% that you're referencing?
Challenges depend on your point of view. So if you're an adolescent or a young adult, one of the challenges that you may feel during the transition process is that you do feel some attachment to your pediatric team. Not in all cases, but in many cases. And you may not really wish to leave the familiar environment of the children's hospital. You may feel that you don't have enough knowledge about your CHD. You may feel uncertain or unprepared to make important decisions on your own going forward. For example, consenting to a procedure like another operation, without having your parents, part of that decision-making as well. If you've moved towns or cities between graduating high school and starting a job or going to college or university, you may not really know how to go about finding an adult CHD specialist. You may arrive in the waiting room and find out that you're the only young person there, and you may feel like you don't really belong. And you may discover that adult cardiologists have a lot of patients to see in a relatively short period of time, and you may feel that you didn't get that much time with the cardiologist. So, the first appointment in the adult clinic, if it happens, that's fantastic, but it might be quite different from what you've experienced on the pediatric side. So those are some of the experiences that we know that young adults encounter with the transition process. If you're a parent of a young adult with CHD, you tend to be very attached to the pediatric providers because in many cases, parents have known them for, the pediatric clinic for 18 years and have a very clear recollection of everything that happened in the first year of life, for example. And parents often tell us that they feel very wary about the new adult team, and they're quite fearful of what is going to happen to their adult child. And some parents have a difficult time letting go of some of the day-to-day responsibilities of managing the CHD that really now ought to fall on the lap of the young adult. I was talking to a parent of a 19-year-old recently who has a complex form of CHD, and that mother described in one word how she felt about this whole process. She said, "I'm terrified." And that's not an unusual description for a parent. From the perspective of the pediatric cardiologist, what challenges do we encounter? Well, sometimes we become attached to our patients, and we're sometimes reluctant to let them go to the adult system. And we may be concerned about the availability of timely follow-up in the adult side if we know that our adult colleagues are super busy and have a long wait list. And for some pediatric cardiologists, we feel like we don't have the resources we need within our clinic to help our patients prepare for transition, because as cardiologists, we definitely cannot do it all on our own. We need the support of an allied team around us. And then finally, from the perspective of adult congenital cardiologists, their reality is that they have a lot of patients, growing wait lists, not enough time to see all the patients that they need to see, not enough clinic space, and they need more colleagues. And so the transition process is stressful on their end as well.
Thank you for highlighting it from so many different perspectives. I think that it's important to look at it from every lens that exists. And, for someone living with congenital heart disease, I think it's easy to appreciate how that can be such a difficult transition, especially when there's typically a lot of other personal things going on within someone's life in that period of time. It might be difficult to kind of assume the responsibility of your own health, especially if you don't know that much about your congenital heart disease from a medical perspective. And I think that's why it's really important, as you touched on previously, for the transition process to occur a couple years before someone actually does turn 18, so that from everyone's perspective, both the person with congenital heart disease, their family, their pediatric provider, and their future adult provider, they're able to kind of work out any of these challenges that you mentioned, rather than feeling rushed to do this.
Starting early is key. And you're right, we all have different perspectives. I want to be clear, the perspective of young adults in there is the most important perspective. Perspective of parents is also very important. The perspective of cardiologists is arguably less important. Ultimately, young adults are at the center of all of this, right? But everyone experiences it differently.
For sure. And do you find that those that tend to seek out more care are those that have a more severe form of congenital heart disease, or do you find that any association exists between those that are more willing to seek care?
Well, yes, there is an association between severity of the CHD and loss to follow-up. So loss to follow-up is higher among those with simpler forms of CHD. That said, persons living with moderate CHD or CHD of great complexity or severe CHD also have loss to follow-up that is simply too high. 20% for moderate and complex CHD in terms of loss to follow-up is what we're currently experiencing in Canada right now. And that really should be 0%.
Mm-hmm. And do you find that those that are lost to follow-up then have more medical complications as a result of this?
Well, there's later detection of complications. So, for example, those who've had repair of a condition called coarctation of the aorta, they may be less likely to be diagnosed with high blood pressure because that is a common association with having coarctation repair in the past. Likewise, for persons living with tetralogy of Fallot, many, not all, but many need a pulmonary valve replacement in adulthood, sometimes in early adulthood. And there are definitely delays in terms of getting a pulmonary valve replacement if you are lost to follow-up. Among those who do have loss to follow-up of more than 2 years and then get back into an adult clinic, one study from the US showed that they have a 3-fold higher likelihood of needing a procedure within the first 6 months of arriving back in the adult clinic. So it's not that becoming lost to follow-up creates complications. That's not what's happening, but it does delay the recognition of new complications and ultimately can make it more difficult to treat them. And if you'll allow me, I just want to loop back to the previous question too. You were asking about, are there other associations between having lost to follow-up beyond just the severity of the CHD? And I would say that there are. So a number of studies have shown that males are more likely to become lost to follow-up. Those who live far away from larger centers, larger cities, more than a couple of hours away by driving time, are more likely to become lost to follow-up. And those of lower socioeconomic status as well often find it difficult to take time away from work, and therefore getting into the adult appointment can be more difficult. In the US, being Black or Hispanic is a risk factor for becoming lost to follow-up. And we don't have good data in Canada with respect to race or ethnicity, but I'm personally of the opinion, based on my own observations, that First Nations Canadians are at a significant disadvantage and therefore at higher risk of becoming lost to follow-up as well.
Thank you for highlighting that. I think that sometimes we forget about the social aspects of health and how that really does play a huge role in someone's ability to seek healthcare. And it may be a lot of things that are out of their control that kind of prohibit them from being in a state of optimal health. So just to kind of keep that in mind, I know it's a systems issue that really needs to be addressed, but definitely something that we should all be working towards in the medical community.
Absolutely. You know, we call these the social determinants of health, and they have a huge impact on health outcomes. With respect to the transition process per se, we need more data in Canada. But there are many studies of adult heart disease in other jurisdictions, particularly the United States, which have highlighted the huge role of race, ethnicity, education, socioeconomic status, how far away you live, your previous exposure to racism in healthcare settings. All of these have a major impact on health outcomes in adulthood. And so we need to pay attention to those in Canada with respect to transition for sure.
Sure. And for anyone listening who has congenital heart disease and may have some social issues that become challenges when seeking care, I think that it's important to kind of vocalize that to your healthcare team so that they're aware of some challenges that you might be facing and see if there's anything that can be done to make it easier for you to receive the care that you need.
Totally agree.
And kind of along a similar line, is there anything that specific that both pediatric and adult congenital heart specialists do to ensure that this transition process is smooth? Any specific steps that are taken?
So with respect to pediatric cardiologists, what I would say is that to make the transition process successful for your patients, you need help, because cardiologists can't do this alone. And I touched on this already, but I'm going to say it again. You know, cardiology nurses are essential to the success of your program. Cardiology nurses are fantastic at doing transition preparation with teenagers, in my experience. And we also, as a program, need to support parents too, as they go through this process themselves. We need to explain to teenagers and to their parents in advance, starting in early adolescence, what's going to happen over the next few years. We need to make a point of meeting with teenagers one-on-one for at least part of the appointment and starting to talk about adult topics like smoking, vaping, alcohol use, marijuana, and yes, sex, contraception, pregnancy. You know, we can't and should not ignore that with our adolescent and young adult patients. And as pediatric cardiologists, we also need to make sure that we're partnering with our adult cardiology colleagues and that we have a good way of transferring the information needed about the heart history of this young person to the adult side. And also on the pediatric side, I think that we need to start screening for mental health challenges because we know that they are common in young people with CHD, more common than the general population. And unless we have tools in place to screen for it, then we may be completely unaware that they're there. And by screening, if we have you know, resources in the community that we can point people to, then that can be of benefit to them. And this is something that the nurses I know at SickKids do a really great job of, and I've learned about this from them.
I think approaching the transition process from a holistic perspective seems to be a very ideal method of going about it, and just kind of recognizing that someone with congenital heart disease also is a person too at the end of the day, and you know they have other aspects of their lifestyle that need to be taken into consideration, as you mentioned, and just knowing that it's a safe space within your circle of healthcare providers to talk about these things like mental health, like lifestyle choices. It's really important for people to kind of hear that message and know that.
On the adult side, yeah, and I absolutely agree with everything you just said. On the adult side, in terms of what adult congenital heart disease cardiologists can do to ensure the transition process is successful, I would say that they and their team need to continue the teaching that began in the pediatric clinic, because it's not like 18-year-olds have it all figured out. So, the education process isn't finished for most people at the age of 18. I think also adult congenital specialists need to spend a bit more time during the first few appointments than they might otherwise, just to build rapport. And it's really helpful for the pediatric team if the adult congenital team provides us with some feedback in terms of how the transition process went for a given patient. And finally, I think what the adult providers can do to make the transition process successful is to not make drastic changes in patient management during the first appointment, because we've heard from patients that can be a bit off-putting. And so those are the sorts of things that I think adult specialists can do to make this successful.
Great, thank you. And I think that's great for people to know. Maybe if they feel like some of what you said has resonated with them, they can vocalize that to their new team and just kind of let them know these are the things that I think would be helpful for me as I'm going through this transition process.
Advocating for oneself or for your adult child, those are great things to be doing. I love it when I see young adults advocating on their behalf.
Can you comment on the level of support available in both pediatric and adult congenital heart disease centers and how they might compare to one another?
Well, I would say that in general terms, adult CHD programs are typically less resourced with respect to social work supports and nursing supports within the clinic. And we don't have enough adult CHD specialists around the country or nurses who have special training and experience in this field. Outreach clinics or traveling clinics, two terms to mean the same thing. They're less available to adults in Canada with CHD. Many pediatric programs around the country for many years have run outreach clinics. So, for example, there's an outreach clinic that goes to Yellowknife from the Edmonton program here about 8 times a year. But the equivalent doesn't exist on the adult side, simply because there are not enough adult CHD specialists to run them. And so for adult age patients who live further away, getting to an appointment can certainly involve a lot more travel than it did as a pediatric age patient. So in general, there are a lot of challenges with respect to adult CHD care in Canada, and it comes down to the growing number of survivors of CHD who are now adults, and the lack of human resources that we have.
I think that's something that can be really worked on within the medical community. I know it's not an overnight solution, but it's great to raise awareness about it and just kind of highlight that there is a need to kind of expand the care provided to adults.
Absolutely, and there are definitely efforts underway to increase the number of adult CHD specialists in Canada, but as you know, that doesn't happen. That doesn't happen overnight. It takes many years to train people.
And to kind of support the care of those living with congenital heart disease, there are other specialists that can participate in that. So can you kind of touch on the role of other healthcare specialists and other allied healthcare workers in the care of those with congenital heart disease?
Absolutely. So I've already touched on the role of cardiology nurses, but social workers can help with transition too. And I've been fortunate to be able to work with a social worker who works as a patient navigator and works with adolescents and young adults after they leave the pediatric system, and while they're spanning that divide between pediatric care and adult care. And navigators who are social workers by training are well equipped to help address some of the social determinants of health that we talked about before, and can be an important source of emotional support, and can help with the development of what we call self-management skills. Some of those skills that relate to taking care of your health condition on a day-to-day basis in partnership with your medical and nursing team. And likewise, access to psychologists or other mental health providers is also really important to those who need it during the transition years. Because if you're struggling with your mental health, then taking care of your heart health is not going to be priority number one, and it's just going to be harder to take care of your heart health when you're dealing with anxiety or depression or both. So I think that both of those allied providers are really important for our patients.
And to anyone listening, if you feel that you could benefit from being connected with some of those providers, mention that to your cardiologist or to the nurse in your cardiology clinic, and they can try and connect you with some of those resources, because it might be difficult to navigate on your own and you might not know where to look and where to reach out to.
Completely agree. Yeah, great point.
So if someone is wanting to ensure that their care is transitioned smoothly, or a parent wants to ensure that their child's care is transitioned smoothly, do you have any advice for them?
Absolutely. Feel free to advocate on your behalf or on behalf of your adult child. Inquire with your pediatric cardiologist about what their program or clinic provides with respect to transition support. Request one-on-one teaching if it doesn't otherwise exist. Inquire about the possibility of meeting an adult CHD specialist during the last appointment on the pediatric side. Try and find a family doctor if you don't have one, because having a family doctor can be a very important source of some continuity of care. And connect with other people with CHD to find out about some of the resources that they've benefited from. Connecting with other people with CHD can be an important source of emotional support as well as people go through this. Those are the ideas that come to my mind.
I think it's really important to recognize that there is a community out there, and there are many people that might have encountered similar challenges to the ones that someone else might be facing leading up to a transition process. So I think gaining that kind of advice early on is really important. Communities like the Canadian Congenital Heart Alliance, we try to connect people that have similar experiences. And as you mentioned, having a family doctor that is a constant for you throughout that transition process from a medical perspective can be very helpful, as they know you very well, and they might have context to provide to your adult specialist about some of the other medical challenges that you've had that are separate from your congenital heart disease as well.
Yeah, great points.
So if anyone would like to learn a little bit more about their congenital heart disease or about the transition process, do you have any specific resources that you can direct them towards?
You mentioned Canadian Congenital Heart Alliance, and that is top of mind for me. There's also an organization called Canadian Fontan, FONTAN.com, which is focused on individuals who've had Fontan surgery. Other organizations in Canada include Encore, based in Quebec, and many cities have local CHD support organizations that can provide a variety of resources. There's also a terrific website called iHeartChange, iHeartChange.org, which was developed by Dr. Adrian Kovacs, a psychologist with lots and lots of experience in the CHD field. And it's a terrific website that I would encourage people to have a look at. Very much geared towards young adults. To the south of the border, there's the American Congenital Heart Association, which has some useful information as well. And finally, I would direct people towards local mental health supports in their community if that's something that they would need or benefit from.
Great. Thank you so much for outlining that for the audience. And we just encourage everyone to look at these resources, see what resonates with you, and connect with your cardiac team if you have any further questions beyond that. So from everyone at the Canadian Congenital Heart Alliance, we'd like to thank you, Dr. Mackie, for joining us today. It was a pleasure.
Thanks, Amanda. I enjoyed it. And I appreciate you taking the time to talk about transition.